Fantastic. And I can see the room is just filling up now. Look, thank you, everybody, for joining us. Obviously here to discuss today the introduction to our promotional webinar for specialist-led education. My name is Liam. I'm one of the partners here at RxTro. I'm joined by Craig Moore, one of the other partners. Thank you very much, everybody, for attending. One of the just little housekeeping things, what you'll see down the bottom on your Zoom, there's a little Q&A button. If you've got any questions or anything during the meeting, please jump on, ask any questions. We've got a few minutes allocated at the end to go through that. And what we'll do is come back to that when we get there. But look, joined by Craig Moore. Thank you very much for joining us, Craig. Yeah, would you like to introduce yourself and maybe give a bit of an overview?
Hello, everyone. Yeah, thank you very much for attending. Yeah, my name's Craig Moore. I'm one of the owners and of RxTro and Bliam. And what I wanted us to have a chat to you all about really is how RxTro's dramatically evolved over the last few years, and has become a vital part of engagement between specialists and specialist groups and primary care environments in 2024, and it's only going to become even more powerful as we go forward into the next few years as we continue to evolve the platform and how it operates. What we've noticed in working with primary care for the last getting close to 10 years now, in helping primary care engage with companies and products and services in the industry, is that there is a real need for primary care physicians and GPs to be continuing to be upskilled in what's new, what's happening, but also who's who in the zoo. There are 40,000 specialists in Australia across multiple different disciplines. There's about 30,000 GPs, and obviously there are millions of patients. And RxTro is in an amazing position to support that primary care environment to engage more effectively with the specialist environment. Fundamentally, the way that the healthcare system in Australia is set up is that the primary care is really the doorway to other products and services and specialties due to the regulations here in Australia, where the vast majority of the foot traffic, if you like, or the patients that are out there initially start their journey from maybe a pharmacy, but fundamentally very quickly into a primary care or GP setting. And there the GP is responsible for obviously understanding what the current needs of that patient are and then what to do next. Now, having worked for a number of years in this space from different angles, predominantly the engagement that a lot of these primary care environments get are from pharmaceutical companies and the like that are out there promoting products and services. And what we've really noticed with RxTro is over the last couple of years, there are thousands of specialists who are working hard to try and engage with that same primary care set. So RxTro has been evolving how it engages or provides a platform to facilitate that engagement between GPs, primary care practices, and specialists and their associations or organisations. What we also know is that GPs are really keen and interested in learning more about their specialist referral pathways and their specialist networks, as well as learning more about specific conditions, treatment pathways, new surgery techniques, whatever it might be that's out there. Patients are more and more informed these days due to Dr. Google and Dr. GPT these days, and are coming to the GP asking very specific questions about specific things. And the last thing a GP wants is to be a bit clueless or not know, and the patient know more. And leaning into their specialist and specialist referral network is something that's very powerful, and that they want to do to make sure that they are as up to date as they can be, but also not are they up to date as to what's happening in various specialties. They also know what to do next when they do find a patient. As I'm sure you're all aware, that there are many conditions out there that could be treated sooner if patients are identified more effectively, and not only are they identified, but they're actually put on the right path to the right treatments. So we see RxTro as really being a powerful tool to facilitate specialists and their organisations to engage more effectively with primary care physicians and their practices to help them become more informed about what is available and what is the latest information. which will in turn help the GPs be more effective at more quickly identifying conditions and diseases, and be in a position to therefore action on the right thing quicker, which will be a better outcome for the patient because they're going to get treated more effectively quicker. It's going to be a better outcome for the GP in a primary practice because they're in a way providing a better service, which is, they're small businesses trying to grow and provide expert service as well. And it's going to be better for specialists and their organizations because there's going to be a flow of quality, when I say quality patients, correct patients, if you like, coming to you for the right reasons, which facilitates specialists and their environments to do what they need to do, grow their patient pool, but also treat the patients they should be seeing and see the patients they should be seeing. And the last piece there is also facilitating a two-way business-to-business relationship, if you like, between the specialist environment and that primary care environment. So not just have this as a one-off and letters being shared, but actually build a relationship between the specialists, their organizations, and the GPs and their organizations on a regular basis that enable continued enhanced engagement, improvement, and better outcomes for the patients and the businesses in the area. So RxTro is on a journey to continue to evolve what we do to facilitate more engagement and better engagement between everyone involved in the network. And we really see this as being an important part of enhancing primary care's ability to help the greater populace there and get better outcomes for patients. So we're excited about what the future is. But just so you know, there are at least 1,500 specialists on the platform at the moment, or organizations that are using RxTro to book appointments to go and see GPs now to enhance that relationship and educate GPs. So this isn't something that's particularly new, if you like, in effort. Specialists and specialist companies have been trying to work out the best way to maintain strong relationships with the primary care gateway to patients, and to make sure GPs know what's going on. This is something that needs to be done more and better and more effectively. And RxTro is a platform to enable that to happen for you. And we continue to enhance what we do. And we're very in touch with what primary care want, having thousands of GPs and practices on our platform, constantly engaging with us. And obviously, we want to make sure we understand a lot more about what you guys want out there to ensure that you're spending the right time with the right organizations to get the better outcomes. So that's RxTro as a whole right now, the way I see it. But I see huge opportunity for all of us to get better outcomes for patients and have a better healthcare ecosystem by enhanced engagement between primary care and specialty. Over to you, Liam.
Fantastic. No, absolutely. And thanks very much for that introduction, Craig. Look, along those lines, and obviously with that goal in mind, what we've been really looking at doing is refining how the system works from a practices perspective. So when we look at things, traditionally the way things worked in a primary care practice was firstly, they would make time available, and they saw that as important, being the gateway, that they needed to be across all the changes. But what we saw was that this was typically sort of done on a first come, first served basis. So the time would be made available, and obviously everybody just competes for it, all things being equal. So what we do is we obviously contact the practices and we have them set up those times. And what that means, obviously, from someone who's wanting to engage with primary care's perspective, is that obviously you can log on, you can book 10, 20, 100 appointments, all within about 10, 15 minutes, obviously streamlining that process. One of the challenges that we've heard from both sides of the platform, but firstly just from the primary care side, is that when they were setting up availability on a first come, first served basis, one of the feedbacks is that potentially the time that they've allocated within the practice wasn't being used as effectively as they wanted it to be. And what the typical feedback sort of meant in that case was that they were hearing from the same people about the same things over and over again, and fundamentally where taking time out of the day wasn't seen as good value. So essentially what we saw was that with a lot of practices, we'd see that instead of making sort of 3 slots a week or 5 slots a week, this might be reduced, but this would have a further knock-on effect. And what it meant was that often these practices were booked out sort of 6, 12 months in advance. The other feedback that we really hear, and when we sort of get out and talk to the individual doctors in the surgery, despite this challenge, the overwhelming feedback is always that they want to hear more from local specialists. So understanding exactly who that network is and who they can refer to is often seen as a gap in their knowledge, and fundamentally, it's an important one. My personal experience with this, I remember when I was actually working in the pharmaceutical industry as a rep, and I had the opportunity to take one of the specialists out that was just starting up in Rockhampton, so it was a regional area. And what was really interesting is this fellow, he was the first ever vascular surgeon to actually start, or peripheral vascular surgeon to start working in the Rockhampton area. It was interesting, sort of took this surgeon around to meet with all the local GPs, and what we saw was that the conversations that were being had, it was fundamentally an advance in the quality of healthcare that was available in the area, in the sense that instead of patients either having to be sent to Brisbane, or risk operations where they were having incisions the length of their abdomen, and obviously all the complications and survival rates and recovery times that come with that. This was a real step forward in terms of being able to do this surgery peripherally, all via keyhole, and obviously have people back at home within a week without obviously the same risks of infection. So my experience with that, and just sort of seeing the engagement that the GPs had and the real difference that this can make to patients' outcomes, was obviously an important thing, something that we're looking to facilitate. The other challenge that we hear from GPs really relates to their CPD, or continuing professional development requirements. One of the big things with it, obviously, there's been a few changes in the last couple of years around the time and the different ways, but fundamentally, in terms of CPD, doctors often think about it as either online modules, or weekend courses, or evening meetings. One of the things that I'll come into when we're sort of talking about the specialists as well is that we're probably really trying to change that paradigm, because fundamentally peer-to-peer based interactions around potentially even sort of real life patients can, if it's structured in the right way, be used to obviously facilitate those continuing professional development elements. That really kind of summarizes what we're sort of seeing as the pain points on the practices side, and really kind of had us sort of thinking around sort of the problems that we're trying to solve in that regard. One of the other big things that we've been doing over the last 12 months is that we've spent a lot of time out talking to specialists and specialty groups of all different sizes. And fundamentally, what we're hearing is that a lot of those pain points really match. When I sort of summarize it, look, I think about it firstly in terms of availability. What we see is that we've got a specialist, and ironically, they're often having to compete for the appointments against a lot of different elements. So there's a lot of allied health, there's a lot of pharmaceuticals, there's a lot of different areas. And what this means is that often the user experience with RxTro is that they're struggling to get in, which, if you think about it from the other side, where we've got the GP saying that they want to hear more from specialists, for us as a platform, this is obviously where we see that there's a potential opportunity to change things. The challenge with it is also as well that we're hearing is a quality element. So specialists and specialty organisations, it's a significant time commitment to go out and engage with GPs. It's obviously time out of the diary. And fundamentally, when they're going out there, the big feedback that we hear is that we don't want to be treated like a typical rep. Essentially, often we're sort of setting up in the back room, and, you know, I've brought a different specialist or what have you, but fundamentally the doctors are coming in. It's very quick conversations. Some are sort of short as 15 seconds. And then what we're sort of seeing is that the specialist is feeling like it was a bit of a waste of their time sort of going out. So this was sort of the other element to it. The final thing that we sort of see as a bit of a pain point is that just the general awareness. And when I'm talking about awareness, I'm talking about the awareness, one, when you've booked the appointment and when you're bringing a specific specialist, the awareness that it's not, you know, just anyone. It is sort of a peer-to-peer based discussion that could be important. And the second one is just that the awareness that Even this is something that a lot of the private specialists sort of do. So what this has caused us to do, looking at these elements of the different sides of the platform, as a successful platform, our goal is obviously to make sure that everybody's getting out of it exactly what they want. And fundamentally what we've done is we've set up a new type of appointment slot. So what this means is that basically practices can make different times available to different audiences. So we could have, for example, one particular day dedicated to allied health, another particular day dedicated to pharmaceuticals, and another particular day dedicated to specialists. But even within the specialist category, what we're seeing is that there's two types of engagement that practices are really keen to engage with. So there's obviously the meet and greets where it's the opportunity just to come in and raise awareness. But once again, there's an opportunity to set up times that could be structured in a way that mean that they could be used for continuing professional development. When we're talking to practices about this, if this is something that is able to be delivered by the specialist, this is something that they're able to set up separate times and keen to set up separate times for. So what we're seeing is that if that's sort of the structure, instead of setting up sort of the 12 o'clock or the 1 o'clock in between session slot, what we're seeing is that practices are actually nominating times at 5 o'clock in the afternoon or 10 a.m. on Sunday morning. And really the expectation around this is that instead of sort of, 5-minute conversations, sort of one after the other, hi, away we go, it can be structured because it's recognized. It can be structured as a full 1 hour event. So what this means from your perspective is instead of taking time out of your day to go in there and basically see everybody one by one, essentially what you can do is you can expect to go out there, have a full audience. A lot of these large practices these days might be 15, 20, 25 GPs, have a full audience that are there for 1 hour of educational content that fundamentally you can deliver. It's seen as a win-win because essentially from the doctor's perspective, it means that, they can hang back for an hour after work, be out, ticks their box. They're learning about interesting things, but importantly as well, they're actually collaborating with people that they're probably going to be referring patients to. So it's a learning environment, but it's a real life example. It's also consistent with the feedback that we get from GPs where they really value that live interaction. And one of the real challenges with the online pieces that we've heard is that often because it's online and obviously because there's a lot of structure around it, sometimes it doesn't have the flexibility to really have those conversations, in particular, potentially about the difficult patient. What they really want is to be in a forum where they can say, well, what about the patient with heart failure? What would we do with this scenario? And how would we move from there? So right now, we've got our customer success team calling out to existing clinics, having these conversations, really highlighting the variety and the value that potentially you guys can bring. And what we're hearing is really good feedback from the clinics, and we've got around 3,000 to 4,000 specifically CPD slots available for specialist audiences only on the system right now. Our goal is obviously to grow this pretty significantly, but one of the real challenges that we're having is understand the question that we're getting from practices is what exactly are we talking about? Who are the providers? And what is the content that we're offering? Which essentially is what we're here to discuss today. So basically what we're setting up is over the next 12 months, every 3 weeks, we're going to be running a webinar series in order to showcase your offerings, how that's different, and examples of what obviously the GPs can get out of it. I'm just going to share one slide just to give you an overview of the structure. Fundamentally, this webinar series, the way we see it working is really as a bit of a sort of structured format to really showcase the value that you guys can bring. So in terms of the structure, the way we see it running is firstly just obviously an overview of exactly who you are. One of the big things that, as I say, there's low awareness around in general practice. is why the importance of GP engagement is important to you guys. There's often a perception that essentially it's all just sort of happening independently. But one of the things that I've really experienced and seen is that obviously active engagement with GPs is a really important part of a lot of the private specialty. One of the things, obviously, when we talk to practices, we talk about the challenges that we've heard from you around the availability, the quality, and so forth. But what we're really keen is to probably throw that question over to you guys to really talk about the challenges that you've had historically when it comes to engagement with RxTro. With this as well, really keen to obviously highlight the specialist-led education slots that are available on RxTro, and obviously the examples with this. The big one, however, that we're really looking to pull together is a couple of case studies, essentially around how your GP engagement currently works. So this might be, we worked with this practice, it was a series of meetings, these were the outcomes that we achieved, and fundamentally, these were the patients that were treated even better. The current concerns that are coming from practices, big thing with it, the call to action around creating these slots. So what we're looking to do is highlight these different providers, understand that the different offerings, and then essentially with the big attitude that the practices then go on to make additional slots available, which means that your ongoing engagement with GPs can go from there. The other side to it as well, I find it's always important just to highlight any materials or so forth that you have available. In terms of what we bring to the party, fundamentally, look, what you have with RxTro is a comprehensive marketing platform. So essentially with the promotional activities, one of the other areas, we send out fax, email to promote the webinar. This is on a national basis, so you're going to 8,000 practices, obviously 32,000 GPs. Typically what we see is that you'll have about 50 to 100 people in attendance at each of these pieces. We've got the Zoom hosting support and obviously any sort of promotional outreach afterwards. So as I say, really kind of the idea here is that if we can really showcase the value that you guys bring to practices, we can drive that increased adoption of specialist slots set available, which means that you're not competing on a first come, first served basis. The structure and the quality of the time is set up a lot differently. So fundamentally, everybody's sort of winning. The GPs are getting more and high quality engagement with the specialists. The specialists are obviously getting more out of it as well. So what I'll do, I'll open up to any questions. I can see that there's been a couple come in, but before we jump onto that, in closing, Craig, did you have any final remarks?
Just to add to that, fundamentally the GP environment or the primary care environment, very similar to I'm sure a lot of your specialty environments, is a time poor, resource poor environment, if you like, in some regards, with are very, very busy, and they too do want to be as effective and efficient as they can be, and being able to manage expectations or help you manage expectations on both sides of the platform. GPs being very aware or engaged and interested in this very specific specialist-led education. The specialist company or provider knowing that they are coming into an engagement with a GP that has been set up in a way with expectations matched, if you like, on both sides, so that this can be as engaging as possible and useful as possible is what this is all about. And it is really interesting to see that we can see different specialist groups engaging with GPs in such different ways around the country, and there is a best practice out there. There is a situation that you are, as a specialist-led organisation, in a position to not only just sort of promote who you are and what services you offer and what type of procedures you offer and what's different about your organisation, get in there, educate, inform, build those relationships and those networks, but then have that reoccurring engagement and reoccurring opportunity to get back in there, get in there once every month, once every quarter, just to go and continue to enhance those relationships and ultimately get a better patient outcome for everybody that's involved. as well as the businesses, the primary care and the specialist care business, to get a better outcome. So the start of this at the moment is this webinar series, 17 of them set up across the year. And if there is interest in for you guys to jump on board and want to provide that webinar, it's a great opportunity for you to open the door and start promoting yourselves, and also encourage the GPs to want to reach out to you and engage with you. But there will be, but the webinar thing shouldn't be the only thing, because there is an opportunity for you to today get out there and book CPD slots in clinics, probably in very close proximity to your organisations. So you can action this now, as well as booking the webinar. And then as we move forward in the next 6-12 months, you'll see more and more features and processes and projects that we're doing to continue to improve that engagement and tools to facilitate engagement between primary care and specialty. We see this as being a real unmet need that we can make a real big difference in. So yeah, that's my little summary there. Over to you, Liam, with questions.
No, fantastic, fantastic. So look, a couple of questions that have come in. So there's one question that I hope it sort of came in early, and I hope that you see that this is exactly what we're trying to solve. But fundamentally, the question is that, yeah, is there a way that GPs can know that I'm a specialist medical professional and not a sales rep? Often I'm treated as if I'm trying to sell something, when obviously everybody's on the same page around treating better patient outcomes. So absolutely. This is exactly what we're trying to solve. It's not a straightforward, quick solution, but fundamentally through this process of firstly engaging the clinic, explaining to the clinic exactly the different audiences that are on RxTro and utilizing the system, and having them set up the specific times that are different based on those audiences. So as I say, with specialists, it might be professional development. With pharmaceutical reps, it might be midday meetings. With allied health, it might be something completely different again.
And just to add to that, Liam, is this is new for the practices as well as it is for you. So it will take time for the practices to get used to this and build this and see the opportunity as well. So which already we're doing with our outreach and our customer success team. And let's say there's thousands of appointments available now, but over time it will become, if you like, synonymous with the platform, that there are specialty engagement as well as industry engagement.
No, this is it. And as I say, when we actually have this conversation with practices, they're often keen to set up a separate time, and it might be, as I say, it's not, it might be 5 o'clock or 10 o'clock, so that obviously all the doctors can make it, because they're not running behind with patients and so forth. So yeah, no, exactly right. But look, what I would encourage you to do, big thing for today. So as I say, after this meeting, we'll send out the dates that are booked. There's 3 slots that have already booked. So there's 14 remaining on the calendar for the year. Sounds like a great example of someone that we can use to really sort of showcase what's available on the system. The next question that's come in is, are the CPD slots available at the moment? And the answer is yes, there are. So there's about 4,000, and we're obviously building that as we go. What I'd encourage you to do, maybe just contact the support just to make sure that you're in the category where we're sort of working closely with the providers as we onboard people. And just the reason for this is just we want to make sure that everybody's expectations are aligned. So essentially, when we move you into the CPD category, obviously when you book one of those slots, we obviously don't want specialist activity to turn up, and obviously the practice to have a bad experience. So yes, Suzanne, if you want to reach out to support, or actually I'll just double check with yours after this, and we'll go from there. Fantastic. So it's a great question that's come through around would subspecialized fields count rather than specialists? Basically, the way the CPD based activities work is that, and there's a structure according to the different colleges around the identified need, the learning outcomes, and the process that you're going through to obviously make sure that the delivery achieve those needs. Fundamentally, it can be delivered. Well, as long as it meets that criteria, it can be delivered by a lot of different people. So what I'd say is potentially let's reach out and have a bit of a chat and just understand more. But I'd say that there does sound like there's potential opportunity there.
I think the main differentiator there, CPD or otherwise, it doesn't always have to be CPD level education in a way. In some regards, when it's a specialist engagement, it can absolutely be working with especially the GPs to understand specialist services that are available for certain topics. So subspecialties are very much still part of the healthcare mix, and what we want to do is use this platform to improve the GP's knowledge of how best to support their patients with the referral network that's out there for whatever the right specialties are. So semantics around some specialists, subspecialists, and the like. Ultimately, what we're trying to achieve is a better informed GP with help a better informed patient and get to the right services.
Fantastic. Absolutely. But look, what I'd say, guys, as I say, we're looking to lock in those last 14 slots for the next 12 months. So please reach out if this is something you're keen to be involved with. Big thing with it, if you're not in the CPD category at the moment and you think you should be, once again, reach out to us. I suppose probably the main point, as sort of Craig said, it's a work in progress for us. We're trying to coordinate between thousands of different people, but if we keep sort of focused on, obviously, we've got two sides of the platform. One wants to hear more of the other, then that's obviously the overarching North Star. Any final closing thoughts, Craig?
I think we covered it. Thank you very much, everybody.
Excellent. Thanks very much, bye. Bye-bye.